On the vaccine front tonight, staff at AstraZeneca and Oxford University say their vaccine candidate boosted the immune response for many volunteers, especially older people. They say people over the age of 70 built a, quote, robust immunity. Officials are calling those results encouraging. We expect to receive late-stage trial results from the company sometime next month. CDC staff put out new guidance that could impact your Thanksgiving plans. NewsNation's Nancy Liu will touch on that in just a moment. But first, here's NewsNation's Washington, D.C. correspondent Joe Khalil. He is getting some new information about the critical and logistically cumbersome plan to distribute those vaccines once one is available. Joe.
Yeah, Rob, and we got a chance to talk to Dr. Fauci tonight about Operation Warp Speed and how you deliver those vaccines. He has nothing but good things to say about Operation Warp Speed. He's been critical of this administration's pandemic response in the past, but he and other critics have all said this is a bright, shining spot. It may be the thing that turns this around when it comes to our fight with COVID. But as Dr. Fauci and many other experts say, even with a vaccine, it's going to depend on how seriously Americans take the virus. In just 10 months, Pfizer and Moderna accomplished what typically takes years, developing a vaccine for a novel virus.
The speed with which this occurred, as you're alluding to, was not compromising safety whatsoever.
The nation's top infectious disease expert, Dr. Anthony Fauci, tells NewsNation Operation Warp Speed has proven successful. How much credit do you think the Trump administration gets for Operation Warp Speed?
Oh, I think they get considerable credit.
Even before the vaccines were approved, Fauci says Operation Warp Speed paid to develop hundreds of millions of dollars worth of doses. Now, pending FDA approval, they'll be immediately ready for vulnerable populations and healthcare workers.
April, May, June, July, that the people in the general public will be able to get vaccinated.
The coordination through the Department of Defense and their logistics people as part of Operation Warp Speed is really critical to this.
Republican Congressman Larry Buckshon, a medical doctor, says that Warp Speed is historic. And he says what comes next, distributing the vaccine nationwide, is just as important.
Some areas may not be prepared for that, but I think they will be quickly, and they're going to be able to use federal dollars to help make that happen.
This vaccine news is definitely good news, and everybody shares credit for it.
On Capitol Hill, even many Democrats like Senator Chris Murphy, who've criticized the administration's pandemic response, have praised Operation Warp Speed.
To the extent that that's a program run by the Trump administration, they should share in that credit.
One area of bipartisan concern. Incoming President Joe Biden isn't getting official briefings on the pandemic or Operation Warp Speed because election lawsuits have delayed the presidential transition process. Dr. Fauci says it's concerning. Is that going to be a complicated task?
The complication is going to be dependent upon whether or not you have a transition.
So are you a little concerned with what you're seeing now? Because there is no transition at this point.
Yes, I would prefer that there be a transition process.
And now, I want to give you a quick timeline here on exactly where we are. By the end of December, so come the new year, we're expecting about 40 million doses. That would only cover about 20 million people for a vaccine, and that's going to go to hospital workers, healthcare workers, and the most vulnerable. Now, we're talking about the end of spring, potentially in the summer, before the general public gets a vaccine, although that timeline may change if other vaccine candidates get approval and do well in their phase 3 trial. So we're hoping that even more come through, and that may shorten the timeline for when the public is allowed to get one. Reporting live in Washington, D.C., Joe Khalil, NewsNation.